Hello, this is Dr. Gay from First Look MRI, and this is a straightforward case of a jumper's knee in a 32-year-old male. He had an injury and now he has edema or fluid signal right at the periosteal interface between the patellar tendon and the mid-inferior pole of the patella. You can see a little cleft of fluid there where it looks like the periosteum is torn and slightly peeled off, and it doesn't go through the full AP thickness, just the deep fibers. And if we go medial or lateral, we see that the patellar tendon is intact, so it's really just the central component that has that injury. And when we see this thickening and edema and sometimes peeling off here, we call this jumper's knee. They can also get the edema in the Hoffa's fat pad like this patient. And these are often people who play sports like basketball where they jump and they have abnormal mechanics of stress at that patellar tendon attachment. This can go on to completely tear if they have a chronically inflamed or injured patellar tendon. It can completely tear, and I saw one the other day where it's almost completely torn, just barely hanging on with the patella elevated. But this is more of a classic one right at the central attachment. Now, if you had a child and they had a ossification down here along the inferior aspect, this can be associated with a similar thing where the children have injury at the patellar tendon attachment and they can get new bone formation, and they call that Sinding-Larsen-Johansson disease. So if you see a child, think about that. An adult, we call it jumper's knee, as in this case. And that's it. Thank you very much.